Thank you, Greg. So this is important, and it's important to every single person in this room and everyone you know. So I'm going to change the slides, obviously. Yep. These are a reminder to me what bit of the subject I should talk about, and if you get bored with me, you can look at the slides. But let me ask you, what if the future of our health system saw a return to the Victorian era, when a scratch from gardening or from shaving resulted in infection, sepsis, and death? What if the greatest medical discovery of the last century, Fleming winning a Nobel Prize, is the greatest medical loss of this century? As Greg said, no new classes of antibiotics into routine use since the late 1980s. What if the number of people die because they can't get appropriate functioning antibiotics? So I'm talking about infections where the infecting organism, whether it's a fungus, a virus, a bacteria, does not respond to the treatment. And the big worry at the moment are antibiotics for bacteria. And actually, you may not know it, but many of us in this room are already grieving because of AMR. My own goddaughter died just over 2 years ago. This is killing in this country and around the world. And it's not just a human problem, it's really complex. This is what's called a One Health problem, because our food systems misuse antibiotics, giving rise to AMR. Our environment systems are flooded with AMR. And actually, one of the worries is that the plastisphere, the plastic contamination of our environment, is actually driving the mutations that make for drug resistance. And that where are the drugs coming from? Well, this just shows you the outflow from some manufacturing in countries in Asia. It's affecting the elderly in particular. And we've got a real emergency, nearly 5 million deaths a year across the world. But it's not just the elderly. Particularly affected is sub-Saharan Africa, but that's going to build from our modelling shows in India and the Caribbean. And in sub-Saharan Africa, in children under 5, 1 in 5 of them dies of an untreatable infection. So they have this double whammy. They can't get drugs, and if they can, they don't work. This is going to spread. This is awful. And the new player on the block is displacement and conflict. There are hospitals around the world where people are coming in from conflict, whether it's Gaza, whether it's Ukraine, with dreadful resistant bacteria and fungi that we don't have the drugs to treat. And it's costing us. Actually, if we don't take action, it's going to cost us 150 billion a year. So with that money, we could run the NHS in England for a whole year. That's a significant cost. And if we don't take action, it's going to cost the food chain 40 billion a year. I mean, this is just getting ridiculous. And I've mentioned the pollution, the microplastics. The Green Finance Institute in Oxford ranks AMR as one of the highest nature-related risks in terms of likelihood and impact facing the UK. So I'm apt to say to people, I care about climate change. We've got to all take action. But this is going to kill far more people earlier by 2050 than climate change will. This is a real worry. And we know what to do. And actually, the return on investment's wonderful. 24 to 1. Invest $1 or £1 and it pays back 24 times. We need drug innovation, and we're going to hear more about that later on. We need diagnostic innovation. We need people to prevent infections. We know what to do. And if we got it right, we'd be boosting the labour force, the workforce, and that would raise GDPs. So you have to start to say, well, if we know what to do, why don't we do it? And I think this is where I, on a bad day, I don't have many, worry about it. What are we going to do? I've spent more than 10 years, as you heard, advocating and campaigning about the world needing to step up about AMR. We've come a long way. When I started, I think it may be a disadvantage of being a woman. It felt like some of the politicians were wanting to pat me on the head and say, there, Sally, don't worry, you know. But now if I say AMR, they say, yes, this is serious. How did we change that? Well, we've advocated, and I'm going to talk a bit about that, but we actually found the funding, got on board Wellcome and the Gates Foundation to get the Institute of Health Metrics to look at the data, the burden of disease and the deaths. And once we had that data, we really began to get movement. And now ministers do know what AMR is. So that's good. We've taken it, AMR to the United Nations twice, to COP26, to the G7, the G20, and even for the month of September, a theatre off Broadway. And I'll come back to that. Last September, we had a high-level meeting at the UN on AMR, and the world agreed a unifying target. Great, based on the IHME burden of disease data, so we better go on funding it. And that target is to reduce global AMR deaths by 10% by 2030. Actually, if we just prevent infections with cleanliness and clean water and vaccines, we'd be nearly there, let alone doing the real AMR-specific stuff. All the governments agreed plans to move us forwards, and one of the things that I've been advocating for nearly a decade is they agreed to set up a new independent science panel for evidence and advice about AMR, a bit like the IPCC. Look at the impact that's had over the years. We need to make the case for what needs doing, and maybe that'll help us get the financing for poor countries to put in place their national action plans. Most countries have national action plans. We do too. But making it happen is another matter. I want that independent science panel to be in Nairobi, Global South owned, run by the United Nations Environment Programme. And we're going to have to think very strategically about how we get investment to happen. And leverage finance, one of our most exciting movements, started here in the City of London, and investor action. Over 86 investors coming together, making guardrails for how to invest to protect antibiotics and to push more. So we are making progress, but golly, it can be hard work. One of the things we've done is look at this antibiotic pipeline. We know we need new antibiotics. I've told you about the fact we haven't had new ones getting into action, but we've also got some data telling us we need 6 to 15, so probably about 10 new drugs every decade. And each one costs just under $3.5 billion to make. Now that sounds a lot of money, but actually, if you think about the savings at $150 billion a year, hey, it's not that expensive. So what are we going to do? I'm not going to go into details, but Britain has led the way. We put in place what's called a pull incentive. It's a subscription system. And if all the rich countries, the G7 and some of the G20 did it, we'd be there, because the science, though difficult, is crackable, as you're going to hear later. We've also been working with industry to develop a standard for antibiotic pollution, and more than 40 factories have got their certification. But I just want to go back to the fact that a lot of people can't access or afford the antibiotics they need. So we need innovation, but hand in hand with access. And I persuaded the last government to give some money to a couple of African countries to try and look at the blocks to why they're not getting access to their people. In this picture, one of those babies is Yusra. She was one of a pair of twins in Desai in Ethiopia. Her twin died 6 days before. She has sepsis, while in this picture, there was an antibiotic that would have worked. Her parents couldn't afford it, so she died a few days later. This is the sad reality of AMR. Again, I want to highlight, and I'm very proud of, the British government. We have the Fleming Fund. We've supported over 270 laboratories in countries around the world because we need more data to know what's going on, where to attack, how to do things properly. And one of the really nice programs is run by the Commonwealth Partnerships for Antimicrobial Stewardship. So it's pharmacists in Britain partnering with pharmacists in Asia and Africa and learning together how to do it properly. I was so worried about all of this, I still am, that I set up a charity called the Trinity College. And last year we ran a challenge with 2.5 million prize money on community action and need based on data to try and improve AMR. And our first prize was Farm to Vet, a free veterinary app in South Africa. So farmers get reliable AI-powered information on animal care, and a very similar one in Vietnam. So through digital, getting information to vets and then being able to send information back. We've just launched, so go onto the website, thetrinitychallenge.org, a new challenge, and this is about trying to improve in low and middle income countries, so it's again about data, stock control and reduce the falsified and counterfeit antibiotics. But when we get good winners, we then give them support because, of course, there are lots of good ideas. A bit of money from us as a prize is great, but then we have to support them to scale, to be the use they can be. But before I finish, let me focus on how do we get the public engaged. Because if we don't have public awareness and engagement, we're not going to see change, whether it's about washing hands and getting vaccines or whatever. So, thanks to Robin up in Edinburgh, whose wife is a doctor, whose best friend is a doctor, he wrote a musical. And it's been developing, and the version we took to Off-Broadway last September has the story of Fleming discovering penicillin entwined with a true love story of a couple that as students were sweethearts, and then they split up, and she's a young junior doctor in the hospital in Edinburgh, and he comes in with cancer. The operation's a success, but then he dies of AMR. This, I should tell you, had a major impact on my husband. 7 weeks ago, I had half my colon out for cancer, and they got it all out. It didn't spread, but at day 5, I had a rip-roaring temperature. My husband remembered this, and I wondered why he was so very upset. He was worrying that I would have an infection. I did, I'll come back to it. That I would have an infection and it would be untreatable. It turned out that in the hospital I'd got a really nasty case of flu. So major op, flu, wow, was I laid low. Now, hands up those who have family or friends with cancer. Yeah. 1 in 4 people get cancer. And they, no, actually it's higher, sorry. The figure I want to say is 1 in 4 cancer patients get serious infections that can take them into hospitals. A survey of cancer docs showed that their biggest worry is AMR, People are dying not from cancer, but AMR, and this brings it home. So we need the public to rise up, to wash their hands, to use vaccines, to choose meat that hasn't had antibiotics used inappropriately. Of course, you should treat sick animals. We want to talk about AMR. We want more action from governments. Each of us has a role to play. And we've got to get it to happen. The next high-level meeting at the UN is 2029. But as the Fleming Initiative, led by Lord Darcy, out of Imperial College shows, we need the science, the innovation, but we need behaviour change, and we need to work all across the world. So join me in trying to make a difference, because each one of you can make this better. Thank you.
Thank you, Sally. You've been working on this for a long time, I think since 2014. I remember you spoke about this at a wide event quite a while back. Major cost, you mentioned $3 billion to develop a new form of treatment. I just wondered, like, in terms of like incentivizing research and development for new antimicrobials, how can we incentivize this better? We're not clearly doing a good enough job.
You're absolutely right. And this is a cultural issue, which is really interesting. Most antibiotics and other anti-infectives are off patent. So we pay for generics very little. And somehow our systems don't want to pay $30,000, $50,000 for a new drug that will be used for a week or two and save the life of a young person or a working age person when they would do it for cancer. So we're not paying enough, which means we've got a broken market. And first of all, we have to start saying to the NHS and governments, you've got to pay enough. These are as important as cancer drugs and other expensive drugs. But then we've done this way of saying, if you've got a drug that's worthwhile that we want, and we look not just at the impact on the individual, but on society, we guarantee a 3 to 10 year subscription where we'll pay for it, but we don't have to use it, so we can protect the drug.
Okay, so give us as I said, you've been working on this for a long time. Give us a success story. Give us some sort of like sense of where we're getting it right, and the lesson we can maybe learn from that.
Well, I think the success is that people now know what we're talking about and are beginning to be concerned that the UN set up the Global Leaders Group, that we're now going to have a science panel. And we're getting, as we're going to hear later, and MIT and others have done, new companies coming in looking and using AI to develop new drugs. That'll bring down the cost. Of course, what we now need is regulators to be innovative, because, as we know, for new drugs, the clinical trials and all of that caboodle is the very expensive bit. But there must be better ways to do that. We found them in COVID. We should find them for AMR.
Great. I love that message to end. Thank you. We wish you well in your recovery as well.
Thank you very much.
Take care.